Good afternoon, and thank you everyone for attending today's webinar, Alternatives to Cultures, presented by David Brown, Dallin Downing, and Scott Bennett of RX2Live. Please be aware that there will be a question and answer portion today at the end of the webinar. To avoid frequent interruptions during the webinar, please type your questions in the question box located to the right of your screen. They will be answered in the order received during the question and answer portion. Additionally, an electronic version of this presentation will be emailed to all participants following completion of today's webinar, and a recorded version will be available on the website for members only. Again, we would like to thank you for attending, and I'll now turn things over to David, Dallin, and Scott.
Thank you, Alex. Appreciate it. Welcome, everybody. I'm David Brown with RX2Live and Business Development. I want to thank MGMA for hosting us today and allowing us to present on their webinar that they have each month. Delighted to be a member of MGMA, and here I'll do a little shout out for our chapter Central Coast here, California. Small but active. Good to know. I want to thank everybody, and as Alex said, everybody will be on mute for a short while until we get to the question and answers through the chat box, if you will. And that'll be at the end of our presentation. All registered attendees will get a copy of these slides as well. So with that, I'd like to introduce my colleague, Dallin Downing. Dallin is the brand manager for all our lab services and the expert in the field of our PCR. So he's going to educate us as to alternatives to cultures, and put your seatbelts on and take it away, Dallin.
All right, great. Thank you, David. It's an honor to be on here, and thank you for having me on, and thank you MGMA members for joining us today and spending some time talking about some technology that's really pretty exciting and is revolutionary. And so I just wanted to give a shout out to Scott as well, Scott Bennett, for joining us, and he's our expert from the lab, and so we'll be hearing from him throughout as needed, and also at the question and answer at the end. So with that said, let's just kind of give you an overview of what we'll be talking about here today. First of all, we want to introduce RX2Live, who we are as a company, some of the things that we're doing to help out physicians and medical professionals in a lot of different ways. Then we'll talk about the traditional culture method that a lot of practices are continuing to use today. And then we're going to talk about what is qPCR technology, or quantitative polymerase chain reaction. From what we've heard and talked to about out there, there's still a lot of practices that have not shifted over to this technology. So we're going to talk about what it is, what the benefits of PCR testing are, and why it makes sense to move forward with this type of testing for lab services. We'll touch on briefly the lab services that we have through our lab partner, and then we'll touch on insurance coverage, and then the office procedure that is done when the lab test is taken and sent into the lab. So first of all, who is RX2Live? You may not have heard of RX2Live before, but we like to look at ourselves as a disruptor and champion of the medical and wellness industry. We're bringing forward cutting-edge programs and systems and products that are revolutionizing the way many practices and doctors look at what they do on a day-to-day basis. But the bottom line is three main areas. Number one is we want to help the physician, help the practice improve patient care. That's a common goal that we all share, is getting the best possible patient care to the people that we see on a daily basis. Number two is to increase revenue to the practice. There's no, I'm sure none of you are any strangers to the difficulties that are out there for independent physicians, particularly with the increasing government involvement and insurance challenges. It's becoming more difficult to generate that revenue. So we're bringing forth programs to the practice that help and aid with that. And then we also help practices provide comfortable for retirement. So, you know, doctors work their whole lives in practices, and they want to make sure that they have a comfortable retirement, not just in savings, but the value of their practice. Instead of walking away from their practice, we want them to be able to sell this valuable asset to help them have a more comfortable retirement. So we've been able to help practices with that as well. So our mission briefly, as is stated on our website, is to provide superior healthcare programs to positively affect millions of lives. And we're well on our way to that, and we should hit 1 million lives in the not too distant future, and then we'll just keep expanding and increasing beyond that with the programs that we have available. So we service 3 vertical wellness markets. We work, like as mentioned, we work with the independent physicians, practice owners to help them. We work in the senior wellness space, which is a growing part of our population, more and more demand for senior wellness services. We have a lot of things that can help the seniors and the centers that care for them as well. And also corporate wellness, which is a huge market out there where corporations are realizing that the health of their employees is the key to their success. So that's who we are as RX to Live. Some of the people that we associate, or some of the programs, what we do, just a quick snapshot, is I won't go over this in detail, but we're talking about labs here. Respiratory, GI, PGX, that's just one of the products and services that we offer. And you can see on this screen kind of a quick snapshot and overview of
the broadcast is now starting. All attendees are in listen-only mode.
These are the programs that we have available for our practices. And then who's the company we keep? Here are some of our valuable and valued partners. Signature Healthcare, we're a proud partner of TIPA, which is the Independent Physicians Association. C-Suite Network, you can see the other companies there that are proud to support and partner with RX to Live, as well as Nova DX, which you see down there, which is our key lab partner. So these are some of the main companies that we are currently working with. Next up, we want to take a look at, we've received several awards in the past recognizing our contribution, but just real quick, wanted to mention a key milestone that we've hit. RX to Live has been recently named as to the top 50 companies in healthcare by the International Forum on Advancements in Healthcare. That's quite an accomplishment. There's quite a long list of requirements that they look at, categories for rewarding this to companies, and so we were honored to receive that award in Las Vegas just a few months ago. So let's dive in now to the traditional culture. This is what many practices are still using. The traditional diagnostic tool for identifying bacteria used by many physicians is called a culture, and of course a culture means to grow. And anytime we're growing something, it's going to take time. It takes time to grow, and so that's one of the things, the evolution process. Not only technology in business, in computer technology, but medical technology has greatly advanced since the late 1800s. When Julius Petrie invented the Petri dish, and they started growing cultures as a microbiologist. So this was back at the time, about the same time that the typewriter was invented and went to market. So we would never think about going back to the typewriter today with all the technologies and computers that we have, but we're continuing to use outdated technology with this culture. Many practices are, because they just haven't heard about the qPCR, or they don't know how to implement it. So that's what we're going to talk about today, is what it is and how it could be implemented into any practice quickly. So of course, with a traditional culture, it requires a sample collection, the handling of the pathogen. We have to preserve it and store it. There's strict guidelines that are involved in keeping the culture alive within 2 hours and kept at room temperature. These cultures provide less than 1% of known microbes that will even grow in a petri dish. Cultures have a high probability of returning no growth results. So we could take a sample, we could put it in the Petri dish and wait the 3 to 5 days for something to grow, and maybe nothing grows, and so there's no results that come out of it. Anaerobes are extremely difficult to grow in a culture as well, and fungi can take up to 20 days or more to get a result. So it takes several diagnostic tests to identify anaerobes, aerobes, and fungi, which of course is costing the patient for each test. Multiple tests are required a lot of times, in addition to the extra time that it takes to wait for the results to grow. So looking quickly at the traditional culture labs versus molecular diagnostics, cultures were designed to grow a single cell. It's a planktonic bacteria, otherwise known as professional pathogens. Molecular PCR, on the other hand, provides a complete picture that allows the doctor to get a better informed decision as to how they're going to treat the patient and treat the illness. So just skipping down to kind of the bottom line here, the most significant factor that PCR technology delivers is accurate data of what is living inside a patient's infection, so you can be confident in treatment decisions for the recovery and overall health of the patient. So that's the bottom line, is just giving that actionable diagnostics to the doctor, not only accurate and more comprehensive, but quicker, so that the patient can be treated quicker and begin the recovery process quicker. So what is qPCR? Let's dive in a little bit deeper. Like I mentioned, quantitative polymerase chain reaction is the full term, and it's a method that allows amplification of a pathogen in real time. So it's a unique sequence. It's developed to detect a specific pathogens. So this is done by actually testing the DNA or the RNA of the target. So it gets right to the heart of the matter. qPCR is rapid. There's 12,000 reactions in a 45-minute period of time, and the qPCR is the most accurate technology in gene detection in the world. It's the gold standard right now in lab testing. So off to the left here, you see our GI, UTI, respiratory, nail, and wound. These are tests that we can do using the molecular PCR testing. And this slide just shows a quick comparison of the traditional culture versus the molecular PCR through GenetWorks, which is our partner lab. So with a traditional culture, it's outdated technology. Again, back in the 1800s, late 1800s, that was developed. Only less than 2% of microbes can even be detected in a culture. Samples need to be plated within 2 hours to prevent false positives. And this is a big one. Antibiotics can mask positive results, creating false negatives in a culture test. So with the increasing use of antibiotics that we have in the world today, this is becoming an increasingly big issue and concern. Results take 3 to 5 days, even up to 20 days for a fungal culture. Only looks for 5 to 6 pathogens with a 29% error rate, and evaluates only 6 to 7 antibiotics for sensitivity. On the right-hand column, you'll see molecular PCR. It's a very accurate diagnosis, and it's all within 24, or I say 40, the slide says 48 hours. Most of the tests are done and back to the doctor within 24 hours, so very, very quickly. Detects 26 pathogens, bacterial and fungal, and more. Unaffected by concurrent antibiotic use, so the antibiotics in a patient's system do not affect this test. Detects multiple pathogens simultaneously, so you don't require multiple tests, which takes more time and money. Detects pathogens that may not be detectable in culture. Faster turnaround, like we've mentioned, that may decrease time to healing, which is huge for the patient. Identifies 9 classes of antibiotic resistance markers and may reduce unnecessary drug exposure and adverse events as a result of prescribing drugs. So at the bottom here, you'll see our mission is to deliver meaningful, personalized medicine results to patients and healthcare professionals through the latest and most advanced methodology and instrumentation. So that's what it's all about, is getting the best technology available in the hands of doctors so that they can quickly and effectively provide better care for the patients. So quickly, molecular versus culture pathogen identification. The sensitivity of the molecular test is 3 to 5 times greater than a culture with high specificity. Again, the turnaround time can be as little as 12 to 24 hours compared to 3 days, 5 days, or 28 days on a culture. Contamination risk is very low because the sample doesn't, it's a DNA RNA test, so the sample does not have to remain living, not required to have a live specimen. And the strain typing is built within the technique. No two-step required on that testing process. So looking at the PCR advantages and benefits, again as a review, samples are not easily affected by time and temperature, so it's much easier for the staff to handle and work with. No biohazard storage required. The PCR technology, it actually extracts the microbial DNA from each sample. So there's no time involved in waiting for the culture to grow. Very accurate, identifying 99.8 to 9% accuracy with yields greater than 95%, analytical sensitivity and specificity. Within 24 hours, we provide quantitative PCR with bacterial load, identifies bacteria regardless of recent antibiotic use. All microbes and fungi can be tested within one test at one price. Identifies difficult to culture pathogens. So this test will be able to provide results on pathogens that may not even be showing up on a culture. This test also detects antibiotic resistance genes for 8 antibiotic classes and delivers an antibiotic recommendation sheet for reduced antibiotic utilization. And then improved patient outcomes and satisfaction. So again, that's a goal. If you can kind of imagine as a patient or a sick person with a UTI infection or a GI having to maybe they wait a day or two before they go to the doctor, and then it's another 3 to 5 days before they get the test. I mean, that's over a week that they've been waiting and possibly in pain and waiting for relief. So with the qPCR, those results are available to the doctor immediately and right back to the patient so they can get treated. Antibiotic resistance. This is a growing problem. The use of antibiotics is the single most important factor leading to antibiotic resistance around the world. And antibiotics are amongst the most commonly prescribed drug in human medicine. Up to 50% of the antibiotics prescribed for people are not needed or are not optimally effective or as prescribed. So this PCR technology will be able to help pinpoint the issue so that the right types of drugs can be diagnosed in the right dosage to cut down on this antibiotic resistance. So biofilms is an issue as well that goes along with that. A biofilm forms when certain microorganisms adhere to the surface and reproduce. A biofilm bacteria resistant to antibiotics allows infections to persist, and it evades detection using the culture method. So again, like we said, the culture method is less effective because of the proliferation of antibiotic use. With PCR technology, the DNA-based forensic testing, the whole genome, it tests the whole genome sequencing, superior results for patients for prompt and accurate diagnosis of bacterial disease. Bottom line, patients will be treated more effectively when the identity of any and all bacteria in the tissues can be accurately determined. So what does the CDC say? During an influenza outbreak, the CDC recommends PCR testing to avoid the possibility of false positive and false negative results during influenza season. So big endorsement there by the CDC for PCR testing. So healthcare facilities, infections are a huge issue and a huge problem. This is just a snapshot. The highest infection rate, 90% of healthcare facilities, patients are reporting UTI infections, 83% pneumonia, 77% MRSA, 71% the catheter-associated urinary tract infection, and 66% skin and soft tissue infection. So it's a huge problem. You can imagine all these patients, especially the elderly, that have a lot of UTI. I've heard they have on average up to 5 UTI infections a year, and that's just a result of not pinpointing the issue and not being able to take care of the underlying problem, as opposed to masking it with prescribing just mass amounts of antibiotics. So the lab is very important that we use in doing PCR testing. We will only utilize a high complexity molecular diagnostic infectious disease laboratory that provides state-of-the-art molecular testing. We provide accurate and actionable diagnostic result within 24 hours for patients. So that's really the bottom line of what we're talking about here, is getting that accurate and actionable information quickly back to the patient, back to the doctor, so that they can treat it properly and get healthy. We are utilizing innovative molecular technologies with higher sensitivity and specificity with our proprietary tests. Our tests are used to discover pathogens causing sepsis in patients. Panels are comprehensive, systems targeted, and unique. And the tests detect antibiotic drug-resistant genes, which can assist clinicians with prescribing the proper antibiotics sooner, resulting in better patient outcomes. So kind of a review there of the benefits of the using PCR technology. So just real quick, we'll go over some of the lab services. The UTI testing, of course, obtains rapid and reliable results, eliminates the guesswork in diagnosing and treating UTI, more accurate and rapid diagnosis. Again, the turnaround time is 24 to 48 hours, much quicker than a traditional culture. One of the most commonly diagnosed illness in elderly, and leading reason why antibiotics are prescribed in long-term facilities, like I just mentioned, an average of 5 infections a year for the elderly in these facilities. And then the UTI testing kits that we have, in fact, all the kits that we'll be talking about here today, all the different lab services, the lab will provide the kit free of charge to the practice to perform the test. Everything is in the kit that is needed to ship back to the lab, and to the proper paperwork in there as well, and the postage. And the UTI tests for a comprehensive 22 UTI pathogens in just one test. Here's a sample report of a urinary tract infection coming back with positive. It shows what type of bacteria was shown, those that are positive, those that are negative. So the doctor can have a quick snapshot of this report. It can be loaded up in the portal for immediate access for the patient, or it can be faxed directly to them. This is an antibiotic resistance panel, UTI panel, antibiotic classification chart. So based on that test, it's just a tool for the practice to be able to see what antibiotics would be recommended. So we don't really need to spend a lot of time on that. Moving on to respiratory lab services, the physicians face a very large challenge and a burden from a variety of respiratory tract infections, and it can be very difficult to diagnose, can be very expensive, and can be frustrating for the patient and the practice to work with. So who's most at risk? Of course, young children, the elderly, the immunocompromised, those with chronic disease and cancer are all at risk for respiratory illness. This test with PCR will target 20 targets in one test. So very quick and convenient, dramatically reduces the time to diagnosis compared to traditional testing methods, and reduces days in the ICU, and of course reduces antibiotic use. Again, this tests the respiratory 20 targets in one test. bacterial and virus. Here's a list of the tests that are looked at. You'll all get a copy of these slides as well if you need to review that in more detail. Again, here's a sample report of a respiratory. This one is showing a positive result for influenza A. So just a quick snapshot of what that looks like. GI services. Doctors rarely receive accurate or timely answers with traditional testing. So this solves that problem. The simple swab collection is less invasive and less hazardous than other methods that are used. So again, quick and easy for the staff to take the sample and to handle and ship into the lab. Again, test kits are free of charge, included with swabs and a prepaid return label. Results are available, secure web portal, delivered electronically within 24 hours in most cases. Certified, our labs are certified by the College of American Pathologists, and they're also CLIA certified as well. And the GI tests for 22 comprehensive GI pathogens. Let's see, it looks like we have a malfunction on our slideshow.
I'm gonna change permissions to you. I'm sorry about that for the time being. And I'm gonna give it to Dallin. You say you have those this slide deck there?
Yeah, let me see if I can pull it up here real quick.
That's embarrassing. Have your computer do that.
Run out of juice?
No, it's automatic update, it looks like. So I don't know why that is. I might be able to go back. Dallin, it's on you now.
Okay, let me know if you can see the screen.
See your family, beautiful family.
Okay, let's get this over here then.
I
Is that
can.
better?
Perfect. I can see
Okay.
Is that the deck itself?
Yes, I believe so. Let's see. Let's try this.
Well, that was unplanned for.
No worries. We'll just roll on here if I can get my screen to cooperate. Okay. Well,
That's where we left off. Better I can try and bring mine back up, but
yeah, I'm trying to get the full screen here. Well, I think this works okay. So GI, we talked about GI, the 22 pathogens that are tested there. This is the 22 targets, the bacterial, the virus, parasites. All these are tested with the GI panel. And here again is a sample report showing the antibiotic resistance results, those that are positive. This is the bacterial toxins panel. And then a GI sample report of, this is the antibiotic classification chart. So wound and nail, we also have the wound and nail panel. It also uses the qPCR technology to testify and to test and identify and provide bacterial, fungal, and polymicrobial pathogens. Quantitative values of each specific bacterial pathogen with a 24 to 48 hour turnaround on the wounded nail. Qualitative and quantitative bacterial load and analysis unaffected by concurrent antibiotic use. And reduction of unnecessary drug exposure and adverse events. So here again is, let's see if this is better. Here we go. Got it. Okay. This is of course, a more accurate diagnosis leads to a more effective treatment. So the wound and nail pathogen provides all these benefits, most of which I've just covered, the bacterial and fungal pathogens. The quick turnaround, low, medium, and high pathogen classification, detection of polymicrobial infections, and reduction of unnecessary drug exposure and adverse events. So again, the mission is to deliver meaningful, personalized medicine results to patients and healthcare professionals through the latest and most advanced methodology and instrumentation. Molecular diagnostics. So here's a sample of 3 different groups. Personalized medicine and wound care assessment of outcomes. So on the left, we have a standard of care group. This is how most practices are treating their patients now. They're doing a traditional culture with systemic antibiotics. And percent of the patients healed, so 244 out of 503, or 48.5% of patients reported being healed in this study. Group 1 with molecular diagnostics as opposed to traditional with systemic antibiotics, 62% reported healed, and group 2 with molecular diagnostics with customized topical antibiotics jumps way up to over 90% of patients reported being healed. So that is the power of what we're talking about with qPCR technology. Let's look quickly at insurance coverage for PCR testing. Medicare covers PCR testing. It pays consistently, pays quickly on almost all claims. So those practices with a high number of Medicare patients are prime candidates for providing this service for their patients, and they can expect quick and immediate reimbursement through Medicare. All insurance companies, private insurance companies, cover the test. Commercial carriers are reimbursing about 50 to 60% of the time is what we're seeing, depending on the insurance carrier, depending on the patient's insurance plan as well. Medicaid reimbursement rates are low, often do not cover the cost to perform the test. So when a requisition form is submitted, the lab confirms insurance coverage and patient copay individually with the patient or insurance. Physicians can assist by applying as many ICD-10 codes as applicable. So in the test kits that we talked about, there's paperwork in there that has a requisition form for the test to be provided, and then on the back is a complete list of ICD-10 codes that the doctor just needs to select on there and send back so that it can be billed properly through the lab. So what is the office procedure? Number 1, of course, is I guess before you collect the specimen is you need to receive the kit. So David Brown is our representative and help making sure that all those practices who are interested can receive the test kits. And then the practice will collect the specimen with the free kits that are provided, fill out the requisition form like I talked about using the ICD-10 codes. And then the sample can be sealed and requisition form completed, put into the prepaid next day envelope that's also in the kit, and dropped into the courier. Courier picks up the sample at your location, delivers next day to the lab. Sample is accessioned and logged into the portal by the lab, and then the sample can be tracked through the portal, through the system, until the results are out. So step 6 is the lab invoices insurance provider and contacts the patient for any copay and out-of-pocket costs. 7, the sample is processed and analyzed within 24 hours of entering the lab, and a report is generated. Results are verified by our laboratory medical director, and the final step, the report is posted on the portal and faxed. So once the doctor has this information, then of course they can report back to the patient and provide a prescription or a treatment plan based on the results of that. So that, David, that pretty much is an overview of the PCR. It's really pretty straightforward and simple. And I guess the final question I would ask is have you as a doctor or have you as a practice switched over to PCR technology yet? And if not, let us know if we can help you.
Well, thank you, Dallin. I appreciate it. We also have Scott Bennett on the phone. Scott, are there any inputs that you have with regards to the PCR and how it benefits our providers?
Yeah, David and Dallin, I appreciate you having me on today. I appreciate everything that you've said. I guess as just a quick view from the way I see it, if you specifically look at, let's just take one of the tests. Let's take the UTI test, for instance. In a culture, it's going to take you about 5 days to get a culture and sensitivity report back on a UTI. 65% of that time, that report is going to come back inconclusive. The biggest reason is because most pathogens cannot grow in a culture anymore. Times have changed. Pathogens, just like everything else, have evolved, have changed, and they've developed what's called biofilm around those pathogens, and it's making it so it's impossible for that to actually grow inside of a culture. We are actually able to take a simple sample, send that in, and give you the actual DNA or RNA of the pathogen within 24 hours from the time we receive it at the lab, and also give you options for antibiotics to kill those pathogens. Now, some of the things that we've learned that are very interesting, in my view, is a lot of times when talking with physicians, most physicians will say, well, E. coli is really the problem when it comes to UTI. And while that statement is not false, it's also not entirely accurate. E. coli is almost always present as an issue, but it's very, very rarely the main culprit in a UTI anymore. UTIs, as well as upper respiratory infections, wound in particular, they're almost always polymicrobial, meaning there are multiple pathogens that are killing or causing these infections, and we need to get really specific in the way in which we attack them. And so while E. coli is always present in a UTI, it's rarely the culprit, and it's never the only culprit. There's always something else there, but that something else is unable to grow in a culture. And so without this test, you're not getting the full picture. And what I would suggest, simply put, is to reach out to David and let's get you set up. It's no cost to you, but let us just try sending in your next 10 patients, your next 10 infections, whether that's a UTI, a GI infection, a wound or a nail, or an upper respiratory infection. Let us run those samples and show you on our report what we can do. Because I guarantee you that within those 10 samples, we will change the way in which you treat at least one of those patients. That something will come up that it'll be something you hadn't thought of, or it'll be some information that you didn't have previously that will change the type of antibiotic, or whether or not they need to be on an antibiotic, or change something in the way in which you treat that patient. And that ultimately is why we do what we do. And that allows us to do things that no one else can do, and that changes the outcomes. And that's ultimately our goal. So we hope you'll give us a shot and give us a chance to prove to you that it's worth it. It's worth the switch. Your MAs will love you because taking the samples are a lot easier, I should say. They're a lot easier. You don't have to keep the sample alive, so there's no refrigeration. It's a much smaller sample that needs to be collected. Typically, it's just a simple swab, and stick that swab in a vial and send it over. So look forward to working with you, and we will all be in touch. Thank you.
Thank you, Scott. Appreciate your comments. The only other thing that I'm seeing in the field basically is that we're having doctors, they may not be able to see the patient, or if they do see the patient, they rather than taking them another step and sending them to the lab, it's easier just to open up a kit and have them give a sample right there and then, and be proactive in the timing. I've also seen where the doctor's schedule is impacted and can't even talk to those people for that particular day, but they're concerned that they have that infection and want to have a test. So it is possible for the patient to actually come to the practice and get a test. It's so easy to be administered, and because there are no climate issues with regards to the sample itself, we're having people self-administer the test with the request form or the requisition already filled out and in the package, and then it's the patient that can send it off that day. So you're actually helping those patients at the time they need it, and making their wellness move forward, as opposed to stagnant, waiting for the next opportunity to make an appointment. So I'm seeing that in the field, but I don't see any particular questions in the chat box. So unless there's any that show up right away, we're going to call it a day and make it an early lunch. But I want to thank MGMA. I want to thank my colleagues Dallin and Scott for being here today, and I want to thank the providers and all the MGMA members who attended today as well. Again, I'm David Brown with RX to Live, and go ahead, Alex.
We actually do have a few questions.
Oh, I'm not seeing them. I'm sorry. Thank you.
It's okay. So the first one is, what commercial carriers are the 40 to 50% not reimbursing?
Scott, have you got that?
Yeah. Yep. It's not that they're not reimbursing. All carriers are reimbursing this test, but just traditionally speaking, if you just take averages, commercial insurance, whether it's a PPO, an HMO, or anywhere in between, is going to reimburse around 50 to 60% of the time. Medicare is going to reimburse around 85 to 90% of the time. Nobody reimburses 100% of the time, and I think that's what the point that Dallin was trying to make. But all carriers, Medicare, Medicaid, and all carriers do cover PCR testing. So it is covered. It just is a matter of how often they'll pay for it.
Okay. Our next question is, any luck with HMOs? Getting an authorization is not reasonable due to the time frame. Any HMOs allowing or reimbursing your company?
Yes, HMOs are reimbursing, and they are not requiring a prior authorization for this test. They would with, like, for instance, a PGX test, but again, exactly the same point that the person asking the question was making, is because of the time sensitivity and because it's an infection, no insurance is requiring pre-authorization for a PCR test.
Okay. Do any standard labs like Quest or LabCorp also do PCR testing? In other words, I'm not available to HMO via capitated lab, then PCR not available to HMO members unless cash pay?
Most of the time, that is correct. So Quest and LabCorp do offer one or two limited panels. You'd have to talk to them in your area. They are not set up nor equipped for 24-hour turnaround. That's not the way in which they've set up their labs or they operate at all. And so we're able to go in and really kind of work with those. Now with that being said, we try to focus, really as a lab on the Medicare side as much as possible, simply because that's the side that we know works. We know exactly what they pay every time. It's consistent, and so it works kind of both ways, both from you on your side and your patients, meaning the patient will never receive a bill. And then on our side as well, because we know what to expect. Hopefully that answers that question as well.
Okay. If HMO, can we offer them cash pay to you for the test? What is your standard cash pay?
Our standard cash pay is $299, and then ultimately it's going to vary by office a little bit. You know, it's something that we can discuss with each office, you know, depending on, you know, sample size and, you know, how many patients, all that kind of stuff. But we can discuss that offline on a one-on-one basis.
Okay, and the last question we have is there any additional revenue captured by the practice?
There's not when it comes to these lab services, other than the, you know, normal office visit or anything like that. Some doctors will have the patient come back to review the report, which is definitely in line with a second office visit if you would like, but there's no way to remunerate the doctor for the test itself.
Okay, and one more just came in. You said Medicare allows and pays, but patient has no out-of-pocket. What about patient share of cost?
So from the patient standpoint, with Medicare, they will, you know, Medicare covers the test. There's no copay or anything that goes along with that. That could be a little bit different if they have like a Medicare Advantage plan or some type of secondary insurance there where there's like kind of an 80-20 split. But if it's straight Medicare Part B, yeah, there's no out-of-pocket for the patient. It is covered. And even if Medicare does not pay us as a lab, they cannot receive a bill from us either. Whereas commercial, if we bill the insurance and they don't pay us, then by law we have to send a bill to the patient.
Okay, and does $299 cash pay cover just PCR, or is there a more advanced test?
No, that will cover the lab test. That'll be our cash pay. If we try to bill insurance and, you know, it's not covered, then we'll send a bill to the patient. We'll also send them kind of a cover letter asking them to call the lab when they receive this bill so we can discuss things with them. There's hardship laws that are in place to knock down, you know, costs based on your household income and different options there. And then our customer service reps will work with people on everything, but ultimately the out-of-pocket cost at that point is going to be $299.
Okay, and that's all the questions we have for today. If anyone has any additional questions, they can reach out to the presenters. Their information is available on the slideshow that will be emailed out following today's webinar. Thank you everyone for attending. Have a good rest of your day.
Thank you so much, Alex.